Let's bring him in. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, on board with us this morning. Good morning, Dr. Joe.
Hi, Ray. How are you today?
I'm doing terrific. How can we not be good with this weather we're having this week?
Oh, my gosh. As good as anywhere in the country. I'm telling you, we are having some great weather, and looks like a great forecast coming up for, our guys out there now playing high school sports and youth sports, and this is our time of year at sports medicine for sure.
Yeah, that's for sure. Where do you want to go this morning?
Well, I wanted to talk about what a joy and what a pleasure and what a privilege it's been to get to be a sports medicine doc, and kind of what it's like when people come in to see us, as a bunch will today and did yesterday, with different types of injuries and kind of how we go about sorting through these. And one more thing I just wanted to mention is about how people bounce back sometimes when they have some of these injuries. But, I even say this in the room. It's when a person comes in, it's kind of like solving a puzzle, and there's different pieces to the puzzle, and you kind of, as you're trying to decide what's going on, what's the injury, and what is the diagnosis, and what are we going to do about it. And so the different pieces of the puzzle, one of them is called the mechanism. How did the injury happen? The classic mechanism we've talked about a lot on your show is a kid will have a plant twist pop and the knee swells, and we've already in the last couple of weeks had several ACL injuries, and that's kind of how it occurs. Or I get we get sometimes runners and other people who feel like, oh my gosh, somebody hit me in the back of the leg and I must have gotten kicked or something in the back of the leg, and they hobble in on crutches and, oh my gosh, they've torn their Achilles tendon, and or they're going to tackle somebody and they feel their shoulder pop and they dislocate their shoulder. So a lot of times it's the mechanism helps us as a big piece of the puzzle. It's not always as obvious as I just pointed out, but that's the first step. The second step is the examination. And so after years of kind of getting our hands on the shoulder, the knee, or the ankle, we begin to look at what's the swelling pattern. Is there any looseness? Is there pain in different areas? And the examination is often very helpful, another piece of the puzzle in trying to diagnose people. So a lot of people think, oh, my gosh, it's all about imaging, or you have to, get a fancy test on everybody. But much of the time, 90% of the time, we have our diagnosis by the time we've looked at the mechanism, how it happened, the injury, and the exam. We do routine x-rays often also to rule out certain more significant injuries where they may have a fracture, may be out for a longer period of time. And people talk about advanced imaging, like MRIs. We do not, in a pediatric sports medicine center, get a chance to get advanced imaging or MRIs on a lot of patients. It's the rare patient in a day, 1 in 20. Now, there are times there's indications, and we have to get an MRI to sort out what's going on. But the vast majority of times we're putting the other pieces of the puzzle together. But I really this morning wanted to talk a little about one piece of the puzzle that's a head-scratcher, even after 30-plus years, and that is our patients who sometimes have an injury that requires the need for surgery. And surgery is kind of one of the pieces of the puzzle that's really hard to get a handle on. And we really often maybe know how they're going to do with the activities of daily living and getting back to school and work and things, but we don't always know how they're going to do after an injury with getting back to sports. And I think you and I have talked a little bit here, Ray, particularly injuries that are post-operative, that are after surgery on the shoulder in athletes. Really, really tricky. And we do use sometimes professional or college athletes to look at to get a sense of that. You and I talked back in the day about, different shoulder injuries and, how a guy like Michael Brantley came back from his shoulder injury. He's played a decade at a very high level. And another guy who was a phenom by the name of Brad Zimmer had a shoulder surgery and he just never was able to return. And this fall, in professional sports, a lot of people are really focusing in on a couple shoulder injuries and post-op. One person, a lot of people keep saying, hey, geez, why does nobody sign Cam Newton anymore? Remember what a wonderful athlete and a wonderful quarterback he was, an MVP of the league. And I read an article recently on Cam Newton, and it's not unlike a lot of what our patients go through. His shoulder just was never the same. He just could not get back to the level of throwing a football. And so you wonder, geez, nobody's picked him up this year at all. A wonderful athlete and quarterback like that. He never bounced back after his surgery on his shoulder. So this year, all the talk seems to be about Baker Mayfield, and we talked so much last year about that labral tear. Even though that's on his off shoulder or non-throwing shoulder, it's going to be very interesting to see how he bounces back from that surgery. It's a tough surgery and tough to bounce back from, and remember, it was only January. It seems like forever ago that he had that surgery done. And the other is Jimmy Garoppolo, Jimmy G they call him. And Jimmy G, gosh, he's brought teams to Super Bowls, and he's coming off a surgery. And you see right now he's kind of a man without a team. People don't know what to do with him. In the sports medicine circles, we know how to put the pieces of the puzzle together. But one thing that really throws us a little bit is how are people going to do after surgery? So as a sports medicine person looking in from the outside this year, we'll be looking to see those people that have post-operatively, especially with shoulder injuries like Jimmy G and Baker Mayfield, to see how they do. Baker Mayfield, not just week one. I know he'll be motivated in week one, but watching throughout the season how he comes back off of that pretty significant injury that he had last year. And also, will anybody pick up Jimmy Garoppolo, and will he play coming off of his surgery? And we would really hope they don't wind up in the Cam Newton category where they never get back to the high potential they had. But it's the reality of sport. When you have a bad enough injury that needs surgery, sometimes we just don't know how you're going to bounce back, maybe for daily activities, but at the very, very high level of high school, college, and professional sports, after you've had that injury and other parts of the body, it's a big question mark, and we watch them very closely in the sports medicine circles. I had several of my post-ops come back in June and July, and they look good in the office, but we'll see what they look like on the field. So that's one piece that kind of throws a wrench in our nice puzzle piece that we try to sort out and figure out what's going on with our athletes, is when they're coming off surgery.
Yeah, some do, some don't, and question marks galore. That's for sure. Joe, as always, my friend, thanks for the insight, the education in the world of sports medicine. We'll talk real soon. Thanks for the update.
Thanks a lot, Ray. Enjoy this great weather, okay, and have a great weekend.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with his weekly visit with us.